So Lenore, what's the process that a patient has to go through if they're interested in Radiesse?
Well, the first step would be to make a consultation with Dr. Chris. At that point, they would come in and they would learn about the process, and we would give them some literature so that they can read through it. The next thing that we would do is just make sure that they're a good candidate. We'd go through their health history, make sure you don't have any bleeding tendencies, make sure you're not on any anti-inflammatories that would keep you from having a hand injection. We don't want you to bruise or interfere with any of your health history. Once you're a candidate, we schedule an appointment to have you come in, and we do the injections. And the first thing we do is start with having the patient wash their hands. And of course, they are consented, so they know what they're signing up for. And then we go ahead and we start with the process. It should be a pretty comfortable procedure.
Terry, is it comfortable when I'm doing these little pricks?
Yes, it's just like little pricks. It doesn't really hurt at all.
Terry did have her the opposite hand done about 2 weeks ago. Mm-hmm. And Terry, did you have any post-operative issues?
None.
Post-procedure issues?
None.
None at all. Good.
And Lenore, if because you get most of the post phone calls, mm-hmm. do you get many phone calls as far as patients complaining about any symptoms or any problems after these procedures?
The procedure is pretty straightforward, and with the post-op instructions that we send our patients home with, we really don't get a lot of post-op calls after the procedure. One of the things that we do stress is that if you do use your hands in your job, we would want you to just, give it a couple of days where you're not doing the same repetitive motion over and over. For example, if you were a hairstylist or if you were working on the keyboard for hours and hours during the day, your hands will be a little stiff, a little sore. That is temporary. You will have some swelling. We recommend using ice for 24 hours and then just giving your hands a break for the first 24 hours.
Awesome.